Good afternoon. I'm Joanne Conroy, President and CEO of Dartmouth-Hitchcock, Dartmouth-Hitchcock Health, and welcome to our Facebook Live. Today, we are going to talk about something that has been top of mind for many people in the Upper Valley, as well as people across the country, is COVID-19 vaccine. You know, this was a little bit of a positive week and a disappointing week. I think it was very positive in that the state of New Hampshire expanded Group 1B, which is the next group to be vaccinated, to include anybody over the age of 65, in addition to people under the age of 65 that have 2 or more comorbid conditions. The discouraging aspect of last week, however, was the fact that the great stockpiles of vaccine don't actually appear to exist. And there won't be a significant increase in vaccine distributed to the states, and certainly in the state of New Hampshire, in the immediate future. Now, hope is on the horizon. We believe that the J&J vaccine may come in front of the FDA reasonably soon, and that certainly will help to augment the supply of vaccine able to protect citizens of New Hampshire and citizens of the United States. But the situation has a lot of unknowns in it, and so many of us are just trying to manage through that while we inform the people that make up our communities and inform our patients and inform our employees. To date, we have vaccinated over 10,000 of our frontline health professionals across Dartmouth-Hitchcock Health. And hopefully over the next few weeks, we'll finish those vaccinations so we can really focus on people that are at greatest risk in our patient population. I'm really thrilled today to have Staci Hermann, who's our Chief Pharmacy Officer here, to answer questions about the current state of vaccines and vaccinations. So Staci, thank you so much for joining us. This is really the positive aspect of the pandemic. Every day we have a meeting to talk about how many COVID patients we have in the hospital and how many of them are on ventilators. But we appreciate the fact that vaccination is a way to mitigate both people contracting the disease and or the severity of the disease they have if they actually do get COVID-19. Now, Staci, you've been with Dartmouth-Hitchcock Health since 2016, and 2018 you became our Chief Pharmacy Officer. Tell us a little bit about your roles and your responsibilities here and the role that you play with our COVID-19 command team.
Thank you, Dr. Conroy. It's a pleasure to be here this afternoon talking with you and the patients of Dartmouth. My role is pretty diverse. It ranges anything from procurement of medications, budgeting of medications, distributing medications throughout our system, also working on integration work from both the operational aspect to the clinical aspect to ensure patient care is consistent across all Dartmouth-Hitchcock Health entities. And also starting to grow our retail and specialty service lines to be able to meet the needs of the patients that we serve, wherever that may be. You know, when I talk to family members about who I am and what I do, the thing and the most simplest way I explain my job actually is anywhere there's a medication that a patient receives within Dartmouth-Hitchcock Health, myself or my team was a part of that and getting that drug to that patient where they are at that particular point in time. So I would say the simplest way is to think medication equals pharmacy, and that is where myself or my team really exist. As it relates to the COVID-19 vaccination efforts, really my role has mainly been around distribution and the distribution channels coming in from the state and then throughout our entire system to ensure that we have consistency. Everybody is in the know with information changing so rapidly, making sure the entire team is up to date on what we're doing and how we're doing it means the most to them, and making sure we have vaccine where it needs to be and when it needs to be there.
So there are some challenges with distributing the vaccine, especially the Pfizer vaccine, but certainly the Moderna vaccine. Do you want to talk a little bit about those constraints?
Sure. So in particular, I would say Pfizer is our most challenging vaccine, and that has to do with the number of expiration dates and the timing of those expiration dates on that particular vaccine. The general public is probably aware the Pfizer vaccine requires the ultra cold storage capabilities. However, the state has opted to not ship directly from the pharma manufacturers to the sites and instead ship to the state and then redistribute from there. What this means is that once we receive the Pfizer vaccine from the state, our 5-day expiration window has already started. In addition to that, there are expiration dates once we remove the vials from the refrigeration temperature and needing to ensure that we meet those time requirements. Moderna is a little bit kinder, if you will, in terms of expiration dates. Once taken out of the freezer, they are good for 30 days. So we definitely are able to store the Moderna vaccines on site for longer periods of time without worrying about them necessarily expiring.
And how about the new J&J and Astrazeneca vaccines? Are they the same in terms of their storage requirements?
My understanding is they would either be our normal freezer type storage, which we do have some vaccines that fall into that category already, or they would be purely refrigerated, which again would be very similar to the flu vaccine. So we definitely feel confident we would have the necessary storage capabilities, whichever method is needed for either of those vaccines as well.
Now, I know that you've been a part of the COVID-19 task force that's not only thinking about how do we get the vaccine and distribute it, but how do we get it into our employees and our patients' arms so they can actually begin the 2-shot vaccination process. And we have had a lot of questions from employees and patients about this process. So what phase are we in now, and how do we recommend that people get registered?
Absolutely. We are wrapping up phase 1A, which is the phase looking at the high and moderate healthcare workers. So the state is wrapping up that phase and in the process of transitioning into phase 1B, which is the remainder of the healthcare workers and anybody over the age of 65, which you alluded to on your intro, Joanne, as well as anybody with a number of comorbid conditions. The easiest way for patients to start that registration, which I will note, the registration site does not open until Friday the 22nd, but that would be to going to the state site, which is vaccines.newhampshire.gov. And that is for anybody over the age of 65. Anyone who has comorbid conditions, they can contact their providers for attestations or referrals to go into the state site to then register.
Now, older populations have a lot of concerns about this. We know that 82% of the people that have died in New Hampshire actually were nursing home residents. So I think anybody that falls in that frail elderly category is very interested in getting the vaccine. In fact, my mom, who's 96, who's recovering from a stroke and living with me at our house, probably asks me every other day, when is she going to get her shot? That appears to be the top of mind for her. How do we explain to elderly citizens, though, how important it is to get vaccinated? What are the ways that we reach them, and how do we reassure them that the vaccine is safe?
Absolutely. I know there's been a lot of concern about the rate or the speed at which the vaccinations made it to approval. One thing I would say for everybody is even though this was expedited, the pharma manufacturers still have followed the very rigorous trial standards that we see for any drug coming to market. And the first step in that is actually making sure that the drug is efficacious. And this doesn't matter if it's a new diabetes drug, a new heart failure drug, or even the COVID-19 vaccination. So the pharma manufacturers first went through those studies to ensure the compound or the vaccine in this case is efficacious. Once they figured out that it was efficacious, the next part of the study process goes into safety and studying the safety profile of the medications. And so this is done usually starting in animal studies. Once they validate the safety component, they are also looking at dosing and how the dosing regimens need to happen. From their animal studies, they will move then into human trials. And this is what has been publicized significantly in the media and actively asking for volunteers to be in these human trials. And so knowing that we have all of that rigor and science behind us, and that is what the FDA actually reviewed before issuing their EUA or the emergency use authorization to allow for vaccinations of the general public. Personally, I believe in the science and what the data has shown us, which is that both shots essentially are needed to get to that 95 efficacy rate that we need to prevent the spread of COVID.
Now, I want to remind viewers that if you have a question, put it in the news feed on our Facebook Live site, and we have people monitoring that. I've got several other questions. If you have had COVID, do you still need to be vaccinated?
I would say absolutely. There is still recommendation from the CDC that anybody who has had COVID or even those who have received monoclonal antibodies to prevent COVID, to get the COVID vaccine. Now, whether you've had COVID or received the antibodies will dictate the timing of when you can get that COVID vaccination, but it is still highly recommended to get it to, again, help prevent further disease progression.
Now, people ask, once they've been vaccinated, can they be in a room with family and friends and not wear a mask? And can they stop wearing a mask in public?
I would still continue the use of face masks. What we know from the studies is that there is a 95% efficacy rate, which means there's a 5% of the population who unfortunately still ended up getting COVID, even though they were vaccinated. The studies were not looking at asymptomatic transmission of COVID either. And so this is another unknown. And knowing that the asymptomatic transmission is where we are seeing the greatest spread of the disease, we are still encouraging the use of face masks in public in particular, as well as at home. I will put the context around if it's your immediate family and you're living with them, similar to now, you do not need to wear face masks. But if you're expanding that bubble, we still need to ensure the appropriate precautions, including social distancing.
Yeah. People probably don't appreciate that within households, I think it's a 40 to 50% chance that people within the household will get COVID if one person gets it in the household. And it probably decreased significantly if everybody isolates within the household and wears a mask. But sometimes you have somebody that's positive before you actually appreciate it and maybe have not taken those precautions when they were acutely infectious. I live in Vermont, but work in New Hampshire. How will I know which state I will be vaccinated in?
That's a great question. As of today, the state of New Hampshire is saying that it is only going to be vaccinating residents of the state of New Hampshire. Vermont is vaccinating Vermont residents. And so we certainly can put, actually, I would say the Dartmouth-Hitchcock website is a great source of information for anyone with these types of questions. And that website also links out to each of the respective state sites for more detailed information.
Now, there's a live question here. What's the difference between a vaccine given by Dartmouth-Hitchcock and one you can get at the National Guard Armory in Lebanon?
Absolutely nothing. In fact, the supply is the same supply coming from the state of New Hampshire. They're just directing them to different sites for vaccination. The state's goal is as many shots in arms as quickly as possible. So as much as they're able to do, they are trying to speed up the vaccination efforts by providing vaccine in different avenues for people to get it.
Why haven't we moved to give everyone a single shot instead of 2 doses in order to get more people vaccinated?
This is another great question, Dr. Conroy. Interestingly enough, the FDA on January 4th came out with a statement saying that there's not sufficient evidence to suggest that we move away from the current dosing of 2 shots. What we do know is that the first shot only provides about a 50% efficacy rate, and it really is that second shot that boosts that efficacy rate up to 95%. And so at this point in time, we are recommending, and the FDA is recommending, the 2-dose regimen. However, they are also saying that further studies need to happen to see if it's even possible to get to a 1-shot series.
Yeah, it was interesting with the Astrazeneca trials that they had made a mistake in dosing in one arm of those trials, but they found that people got a smaller dose first and then got a larger dose actually had greater efficacy than the other arms of the trial. So there's a lot we don't really know yet about how this vaccine works. Really, all the vaccines work in terms of creating a level of immunity.
Sure.
Should I be worried about allergic reactions? How safe is the shot really, since it went through trials so quickly?
Yeah, I would refer to my prior comments about the stringent process through which any drug goes through in order to meet FDA approval. This particular vaccines do have side effects, similar side effect profile for both the Moderna and the Pfizer vaccine. I would say it has allergic components very similar to any other vaccine. We know with any drug, there's always the potential for side effects. With these 2 in particular, people seem to be tolerating the first dose really well. Now that we've started to move into the second doses, we are hearing a bit more of side effects. But these side effects generally are what you would expect, arm soreness. Well, we just put an injection into your arm, so you would anticipate that type of reaction. Fatigue is another one. And I would say this is actually a good side effect, so to speak, because it means your body's immune system is recognizing the vaccine and starting to fight it, similar to when you get a cold and you just kind of feel crappy. Your body is doing the same thing. So I would say the side effects are very similar, mild, and the alternative I think is much worse. So definitely worth it.
Now we have a participant that has a specific question about anaphylaxis. So they have a history of anaphylaxis from an allergy and actually use an EpiPen. Can they choose to receive their vaccination in a safer location or near or in a hospital setting versus just at a CVS or in a car in a line at the Armory?
Yes, I would say patient choice is always available. The state is trying to move as many people to the fixed sites as possible, as that is where they are directing the majority of the vaccine at this time. But I would say if you have concerns, definitely talk with your provider about wanting to have the vaccination in a healthcare setting. We do know the state is going to continue to provide vaccine allocations to the healthcare systems in the state of New Hampshire. It may just take us a little bit longer given the limited supply to get you in, but that is always an option.
Somebody asked a question about flu shots. So they haven't had their flu shot. Do they need to space out when they get the vaccine from their flu shots?
Yes, flu shots or even Shingrix or the shingle shot. I know many people are still working on getting those as well. We do require a 14-day window between the last vaccination, whether it be the flu shot or shingle shot, and the COVID-19 vaccines. So it's just a timing thing at that point.
This viewer says they're medically vulnerable and high risk, but they're not in phase 1B. What do they do?
So the state has given providers the option to attest to say that the provider may have a patient who normally does not meet the definition of 1B, but that the provider feels is at great risk for contracting COVID. And so I would encourage this viewer or any others, if that is the case, to contact your provider because those providers can issue a referral for vaccination at that point in time.
So there's another question about the state sites. They say there are 13 state sites. Where are they located? And where is the best place for this viewer to find up-to-date information?
So I would say there's two websites. The first is the official state site, which is vaccines.newhampshire.gov. Or the second site would be the Dartmouth-Hitchcock official site, d-h.org. The Dartmouth site does link to the state sites. And so those two are going to have the most up-to-date information. And I have heard that there is potential for the sites potentially to be moving. So I actually would refer everybody to those sites just to make sure that they do have the latest and greatest information on hand.
Let's talk a little bit about herd immunity. What does the term mean, and when do you think we'll achieve it in New Hampshire?
So herd immunity is a term that refers to when we have enough of the population in an immune state that would prevent the transmission of disease for those who may not be able to achieve that immunity. That immunity can come either through vaccination efforts or even from people building antibodies through having, say, COVID, for example. There are a number of factors currently at play in terms of when we might see herd immunity achieved here in New Hampshire or across the U.S. Those factors include the availability of the vaccine itself, how fast we can get vaccines in arms. Also, the virus is mutating. And so does that change how fast and how much of the population needs to be immune before we see that herd immunity? So it's really hard to say at this point in time exactly when that will happen, but I would say probably late spring, early summer, as we're seeing more vaccines on the market, we will get much closer to achieving that herd immunity status.
So let's talk a little bit about the vaccines mutating. It's been in most people's news feeds over the last 4 to 5 days. What does that mean for us?
So right now there is research happening about whether the current vaccines will protect us from the mutations of the virus. The phenomenon of a virus mutating is not uncommon. In fact, this is why we get flu shots every year, because the virus changes. What we're trying to figure out is whether the vaccines will continue to provide immunity for those new mutations. There was a paper just released. It has not been peer reviewed yet, but it is looking like the current vaccines should protect us from the mutations that are out there currently.
Yeah. It's a question about a couple that is trying to have children. Should they postpone vaccination?
I would encourage that couple to talk with their physicians about that. To my knowledge, there is nothing to say that, the vaccines right now will cause problems with fertility. I also know that some of the later vaccines coming to market are a different type of vaccine, meaning they are not the mRNA type. I think it's a broader conversation and probably one best had with the provider themselves, because there may also be other medical conditions at play that could put these individuals at risk, and they may want the vaccine as well.
Yeah. My niece is a nurse in South Carolina. She asked me the same question. I said, go get the vaccine. I said, tomorrow. Another question, my husband and I are both in our 80s. Should we schedule our vaccines separately so we can take care of each other if we get sick after the vaccine?
That's a great question. I would say there's nothing out there that says you have to do this, meaning you have to get it on the same day or you have to separate it out. One of the things I would say is just like any other vaccine, once you get it, you may not feel very good. And so if one of you does want to kind of be more of that care provider when the other isn't feeling well, that's great. Some other things to think about would be potentially already having pre-cooked meals in the refrigerator. Again, if you're just not feeling well, you would have all of that handy and ready to go.
So another question from the audience, how long is the vaccine effective for?
That's great. We are actually still studying that. The trials only went out for a few months, and that's how we found the 95% efficacy rate. But Pfizer and Moderna are both continuing to monitor those study populations to see what happens over time, over a much longer period of time. It really is unknown if, for example, we have to have an additional booster. You think about the tetanus vaccines that require boosters every 10 years or so. And this particular vaccine may require a booster. We just don't know at this point in time.
Another question from a member of the audience. I'm a handicapped person who's homebound with no way to transport to a site to get an injection. How would I go about getting the vaccine?
My understanding is the New Hampshire Regional Public Health Services, group is actively talking about the homebound population and how the state can help best serve them. So at this point, I don't have an answer for that particular viewer, unfortunately, but just know that it is an active conversation and more to come.
We have another question from a viewer. Will patients know which vaccine they're receiving, Pfizer or Moderna, and will they have choices?
Yes, when you get the vaccine, you will absolutely know which of the two vaccines you get. In fact, you will be provided what the FDA is calling a fact sheet. This is similar to the vaccine information sheets that you otherwise get if you get a flu vaccine or a pneumococcal vaccine. So that will be provided to you at the time of vaccination. Those fact sheets are specific to the formulation that you are receiving. So there's a specific Moderna fact sheet and a separate specific Pfizer fact sheet. Unfortunately, at this point in time, a choice is not an option. We are getting what the state sends us. So it's anybody's guess on any given day.
Pharmacists give vaccines for flu, shingles, pneumonia. Why haven't they been approved to give COVID-19 vaccines?
Interestingly enough, the governor issued an executive order in July that actually allowed pharmacists to administer COVID-19 vaccinations in the state of New Hampshire. And so I would just say in general, most of the vaccines that pharmacists are allowed to provide really are governed by the Board of Pharmacy. So the fact the governor put an executive order in back in July clearly demonstrated he saw the value of having this part of our healthcare workforce being able to do that. Here at Dartmouth, I can say our pharmacists have actively been participating and administering COVID-19 shots as part of our clinics. In terms of the more broader population, I think right now the issue is more vaccine supply than anything. If I were to wave a magic wand and give every dose for every resident of the state of New Hampshire, I'm sure every pharmacy would be there willing and ready to go to do that.
There's a question from a viewer that actually had COVID, and they said, how long do they have to wait after recovery to get the vaccine?
So we really want to ensure that anybody is symptom-free from any of their COVID symptoms and are not in an active state of having COVID. Once you are in kind of remission, so to speak, and back to normal, that is when you are able to get the COVID-19 vaccination.
It's a question about Vermont residents who receive their primary care from Dhmc in Lebanon. Can they receive the vaccine from Dhmc providers?
At this point in time, no. The state has issued guidance, the state of New Hampshire has issued guidance that we are only able to provide vaccine for New Hampshire residents at this time. The state is aware that we, Dartmouth-Hitchcock, would love to be able to vaccinate not only our New Hampshire patients, but those that live in Vermont and Massachusetts and Maine as well. So I don't know if this is a supply issue, but that is the guidance we have received right now.
The audience should know that we were prepared to put up an infrastructure that we could vaccinate close to 5,000 people a day if need be. But the issue is not willingness to do it. The issue is really supply of vaccine from the federal government, which right now is still constrained. And I think the state is preferentially trying to funnel a lot of that vaccine to their freestanding sites where they believe that more people can have broader access to the vaccine. Will you get an appointment for the second dose of the vaccine when you go to the first?
You will still need to register for that second dose. Part of what makes the second dose challenging is the Pfizer vaccine has a 21-day window between their first and second doses, while Moderna has a 28-day window. And so part of what is driving your second dose and the scheduling of that is which dose you get, or which version of the vaccine, you get. And so until we know which one you're actually receiving on that day, it's hard to pre-schedule those second dose follow-ups.
This is a really good comment because I realized I noticed this on the site. This is a person who's diabetic, and they are a type 1 diabetic. But the website only talks about type 2 diabetics falling under phase 1B to receive the vaccine. And so what do we do about type 1 diabetics? Or do they also fall under the category of medically vulnerable?
So according to the guidance provided by the state of New Hampshire, they would not be qualified. However, I would say they do qualify under the condition that the provider, in conversation with the patient, could make the determination that this patient needs the vaccine and could issue that referral to get vaccinated as part of 1B. But as a general rule, the state is not putting type 1 diabetics into that category.
So another question about the timing of the shots. How important is it to get your second shot on time?
So we do know that ACIP has issued guidance to say, ideally, you should get it on day 21, again, for Pfizer, and day 28 for Moderna. However, if you are unable to get it exactly on those days, it should be as close to possible to those days. For those, and that could even be ahead of day 21 or 28, although we do not recommend going earlier than that. The studies did have some folks receive vaccine a little bit earlier, but going past day 21 or past day 28, there is no absolute cutoff that says the vaccine is ineffective if you get to day 30, for example.
Yeah, we do know that people react differently to the vaccine in terms of mounting an immune response, probably depending on multiple factors, but age is one of them. Younger people mount a faster immune response, and but there's a lot of things that we just really don't know yet. There's a question about additional risks of getting the vaccine for anybody over the age of 75.
I'm sorry, can you repeat that question again, Joanne?
Are there additional risks of getting the vaccine for anyone over the age of 75?
No. We still continue to see the same side effect profile. And so, yeah, I just prepare for a sore arm and, not feeling well. But again, that's to be expected. And it means your immune system is doing what it needs to be doing.
Yeah.
If it's helpful for the public, I in my head mentally was preparing myself for a similar experience to my tetanus booster of just kind of that sore arm type feeling. And it actually was a little bit milder than that. And so, if you reflect back to other vaccines you may have gotten, that's kind of the thought process I would go into in terms of what to feel or what to expect with this vaccine.
Yeah. And I think anecdotally, they say that older adults actually do quite well with the vaccination. Mm-hmm. So I want to thank everybody for their many questions. Our team is going to review all the questions submitted by email and on social media. And I apologize if we couldn't get them to all of them today, but there were really many. And we'll provide appropriate answers on our Facebook page, our FAQs. In closing, I want to thank Staci and thank you for all your great work. It's a lot of nights, a lot of weekends, a lot of last minute calls and filling out forms to make sure that we have the vaccine available for our patients and our community. I want to remind people that you have to continue to wear your masks, social distancing, and if you're a Dartmouth-Hitchcock patient, please sign up on the MyDH patient portal for communication from your provider and visit vaccines.nh.gov for registering to receive the vaccine at the state sites. We know that the Armory here in Lebanon is where they're currently administering vaccines. We know that the SNU arena in Manchester is where they're giving vaccines, but there is a tremendous amount of detail on the state site, so you can identify the site that's the closest to your home. Again, I want to thank Staci and thanks everyone for joining us. Have a wonderful day.